Good evening, everyone. There is some good news tonight in the local fight against COVID-19. Despite a slight uptick in COVID cases, Monroe County has the lowest rate of infection of all counties in the U.S., with more than 500,000 people.
According to the New York Times, Monroe County is #1, ahead of two counties in Oregon, Washington, and Multnomah, in terms of cases per 1,000 people. Kayla Green talked to Monroe County Health Commissioner Dr. Michael Mendoza today. She joins us now live from the county office building. We've got a low infection rate, Kayla, but the county's keeping its eye on those COVID-19 clusters.
Yes, Adam. Right now, he says outdoor gatherings are risky, and he has concerns about moving these indoors as colder months approach here quickly. He says we're at the top now, but he wants us to do what it takes to stay there. Dr. Michael Mendoza says we're seeing clusters in families, at colleges, and in carpools, but overall, clusters are results of gatherings.
There hasn't been a single type of activity. I can't point to restaurants, I can't point to bars or schools or any of the other things that have been open other than the community in general. It's those gatherings that we have in our backyards, in our homes.
While positive cases have gone up slightly since September, Dr. Mendoza says we are also testing more. He also says the large clusters are identifying more contacts per case, which isn't surprising now that schools are open again.
And we're essentially doing greater surveillance in the community as a result of all this testing. And I think that shows when you look at the overall testing numbers going up. But the actual percentage of those tests that are positive is holding steady for now, thankfully. So I think we're detecting more of the cases that have frankly been around all along that we're now only becoming aware of because we're testing more.
As the holidays get closer, he says it's important for us to reconnect with family and friends, but we have to be smart about it.
Particularly if people go home for Thanksgiving and come back, that certainly can increase the risk of infection here in Monroe County. I will say that I think many of the local colleges and universities are looking at being remote, if not entirely during December, a good part of that.
Regarding a vaccine, Dr. Mendoza says he doesn't think one will be widely available anywhere in the U.S. before the end of the year or even the first 6 months of 2021. He says he won't endorse a vaccine until he knows for sure it's safe and effective, and he'll be looking at trials and data to make that determination when the time comes. Live in Rochester, Kayla Green, News 8.
All right, Kayla, thank you. I should mention free testing is still being done at MCC through the State Department of Health.